Hello everyone and welcome to the March video. And this month we're going to be focusing exclusively on data. Now we've put a lot of work into how we handle, improve the quality of our data over the last few years. And we're now fortunate at BMJ to have somebody who's been voted as one of the top 100 most influential people in data-driven business, and that is David Hutcheson. So I'm going to hand over to David to talk about all things data.
Most companies today claim to be fluent in data, but what does it mean to be a data-driven company? We asked David Hutcheson, Head of Data and Analysis, to enlighten us.
A data-driven company is a business which uses evidence to take good decisions. The strategy has focused on three main areas. Those are managing our compliance risks, improving our data quality, and enabling BMJ to be more data capable. So in terms of managing our compliance risks, we've taken a number of steps over the last 3 years, which have been to reduce our risk profile. Some of that has involved reducing the number of people who have access to sensitive data. We've also done some sort of technical pieces of work to simplify our data structures around marketing permissions and unsubscribes. In terms of improving our data quality, there's been a lot of work that's been undertaken by several teams that have collaborated really well. That's included the data and analysis team, the commercial operations team, and the business systems team. What that has involved is looking at root cause solutions to some of our data quality issues, and we've seen where that's worked really well with Salesforce. So when I talk about BMJ being more data capable, for me that's about enabling BMJ or people at BMJ to be able to use information to make good decisions. Last year we developed, in collaboration with the journals team, a journals usage dashboard for institutions, hence the initialism Judy. What was, I think, a real step forward for BMJ in what Judy delivered was enabling a lot of data to be able to be brought together in one place and then made easily accessible. So Judy is built from over 1,000 different reports that are published out of Highwire, aggregated in one place, giving us a view from 3 million records and over 10,000 customers. But a user of Judy is able to access that information in less than 20 seconds and then drill down into any one of the over 60 journals that are available from the Highwire platform. We're also working in some interesting areas which are new to us. So one of our challenges is we'd like to really understand how our users interact with our digital products. So we're looking at developing feeds of digital behavioural data. We're starting with best practice, where we're going to take information about how users who've logged in have interacted with that product and see what that tells us. We're hoping that that is going to be able to not only understand our users better, but it will able then to help us run more effective campaigns and provide more informative analysis in future.
So thanks ever so much, David, and please do get in touch with David to find out more about the way that we at BMJ handle data. And related to that is, of course, our mandatory GDPR training. So I do encourage everybody to take that training. Now, as you'll know, Jackie Staunton and I have been round to every department feeding back the results of the staff survey. And every department has action plans, and I do encourage everybody to work on those action plans to help to improve the departmental scores for next year. But one thing that was very gratifying was the fact that we moved forward quite significantly last year from being in 2016 the 168th best company to work for, to in 2017 we're now the 116th best company, and that's really gratifying to know that our staff engagement has moved forward so well. Now, in the past month I had the privilege of visiting South Africa to visit our partner Cape Town University to do a strategic review of our partnership on PAC, the Practical Approach to Care Kit. And included in that trip, it was a privilege to go to a suburban healthcare clinic and see PAC in action and some nurses being trained on how to use PAC. And it was very gratifying to be able to see how those nurses use PAC at the point of care. And it really reminded me that PAC is probably the product at BMJ that is closest to helping to achieve our vision of a healthier world. It's a really important product. And so I encourage you also to have a look at our BMJ Global Health page, where there's information about PAC, but there's also information about BMJ Global Health Journal, some global health case reports, research to publication, and a range of other global health activities. So thank you all very much for watching. See you next month for the April video, and in the meantime remember that you all have a direct line to me, so please do get in touch either directly or through Speak to Peter, and I read every Speak to Peter message that I get and we act on it. Thank you.